It's not really my recipe. This is not about my personal, dogma. This is what I'd like to show, discuss with you and show you is like years of learning, of practicing, and some pearls of wisdom in the area of that we love the most, which is cosmetic rejuvenation. Dr. Rami, we love you so much. This is your case here. Just to start my talk, because you didn't get to show your beautiful results, so I thought I'll show one of yours. This is a facelift surgery, and of course, some patients either never had a good dermatologist to take care of them and help them avoid or prevent their surgery, or some of them are just like black and white. They just say, you know what, I'm just going to get that facelift. My mom had it at 40, I'm going to have the same thing. But of course, even sometimes, despite everything that we can do as dermatologists, some patients still would benefit from facial surgery. But of course, the point of the talk today is that starting early with the proper customized treatments can prevent or at least delay the need of the surgery. And that's what I will show you here. And the key word here to take home is restoration. We're not here to just fill. We're not here to follow trends. We're not here to apply, what the sales rep shows us. We are physicians that understand the skin, that understand the facial anatomy as you just saw, and we have to approach every problem as we've always done, having a diagnosis and then finding the solution. Unfortunately, today, so many treatments are solutions that are applied to any presentation. And that's what makes the difference between experts that should, as you in this audience, and those who are practicing cosmetic aesthetic medicine left and right. So the facial layers, I think we all need to be familiar with them because every layer needs to be restored. We can't just treat the skin. We can't treat with lasers. We can't treat everything with volume. We can't treat everything with Botox. Although every treatment might have its coefficient depending on the case that presents itself. So starting with the epidermis, I think Dr. Samar did a nice job covering this topic. As you know, I like lasers and treating targets like oxyhemoglobin here to treat vascular ectasia, which gives a lot of age, of course, or treating lentigines and superficial seborrheic keratosis, targeting melanin has been really life-changing for patients, and this is something really old. Today, when we want to rejuvenate the top layer of the skin, we've had these masks for a long time, and the brands are very well known. They work very well. Some people might have sensitivity of the skin or others. And my personal preference is always to go for lasers because they are more precise, they are more controlled. There is no reliance on penetration of a chemical and skin barrier issues. And here is showing you the effect, the immediate endpoint of the thulium laser that we're finding extremely useful in our clinic as it works so well. You can see here a patient about 8 days after her first thulium laser session with good epidermal improvement. Of course, the deeper pigmentation might need a second session with the thulium or using the Q-switched laser on these specific spots. We've had resurfacing for many, many years. We're doing less and less of that with the lasers here, using the YSGG, which is between the erbium and the CO2 in terms of its power and how much thermal damage it can leave on this in the dermis and cause tightening. It's one of my favorite lasers from years ago, but I don't use it anymore. Here's the CO2 laser that I guess most of us don't use anymore. This is from my fellowship years, and you can see the effect that it can do. So, and you can see, I love this picture. Two twin sisters. One is like high maintenance, one is not. You can tell who is and who's not. And the eyelids are very important. We can do the best job on the face, but if the eyelids are not rejuvenated, people look older or they look tired. And there are several things we can do. We can treat the wrinkles superficially, we can treat the laxity, we can treat the hyperpigmentation, we can treat the tear trough, and we can treat the varicosities, and that's really everything there. We love the technique that we've been doing for many years now, known as the smooth eye, where we use a fractional mode of the erbium laser at low power in a back and forth technique similar to the laser genesis to generate enough heat, and that heat can stimulate collagen to renew itself and tighten the skin with zero downtime, just protecting with Vaseline, and wonderful results many times with 2 to 3 sessions, and long-term results. I have patients that I see regularly 4 or 5 years after this package of sessions, and they continue to benefit from it. When there is pigmentation, and it's important to do the resurfacing because the pigmentation needs to be ablated, especially when it is the kind of photo damage, not the dark circles that are hereditary. As in this case, where in this case, which, as you see the result, 6 years after a single session, combination of 3 lasers, the fractional ablative, the Q-switch 755 here, and then the ablative spot ablation with nice results that take time. Most of these people take time, months and months, to see the results as the pigmentation washes off. Sometimes we have to rely to surgery. If you're a dermatologic surgeon, these are simple things to do. Otherwise, we refer to our colleagues, to the plastic surgeons. Sometimes you have that asymmetry between right and left, and doing a simple direct blepharoplasty, brow lift makes a big difference for those patients. This was life-changing for this patient. Here's a patient I treated recently with an upper blepharoplasty. Of course, we try as much as we can to avoid the lower blepharoplasty because of the risk of ectropion or tightening of that area, because the healing is not predictable. So whenever people have advanced laxity of the periorbital area, we usually choose the blepharoplasty for the upper. You refer it to my colleagues at skin experts, and we do the resurfacing on the lower. You can see a nice rejuvenation of the face from one session of resurfacing to the lower eyelid, done at the same time with the upper blepharoplasty. Dermal tightening has been covered, I think, nicely by my colleagues. I just give you my 2 cents. This is from the days, when we started doing laser genesis. You can see how it improves the texture and the pore size, and the flushing overall. And it's quite rejuvenating from sometimes just a single session. One of the best tools we have. This is HIFU, high-intensity focused ultrasound, and when it's done properly in my hands, in conjunction with a good treatment plan, using the volume whenever it needs to be restored, denervating the platysma and masseter muscles that are always tightening out. When you do the HIFU after you've done your homework with the muscle and volume, then it works very well. If you do it alone, sometimes it's not enough because you have other factors that are in the mix. Microneedling radiofrequency has been around for some time. I was reluctant in the beginning, had to adopt that technology because my colleague Dr. Samar really wanted to get it, and we started getting the experience with it. And then we moved on to newer technologies that are more precise, that work with monitoring of the exact depth of the needle that's variable, that's not just like 1, 2, or 3. We can get the temperature control and get nice results from a single session done in our clinic in Beirut with a single session of the microneedling with radiofrequency. And that one was shown, I think, by Dr. Zainab earlier, on this man who is 63, getting remarried soon, looser skin. A single session of microneedling with radiofrequency made a nice difference with him. I have to say that he had also some Botox into this area, but you can easily see that the change to the texture is unrelated to the Botox. Microcoring, I don't want to steal Dr. Narwan's thunder He's giving a full talk on it tomorrow morning, I think early morning around 9:30 or 9:45. But this is about doing punches of the skin, hundreds of punches that leave no thermal damage. So it's like taking your 0.4 millimeter punch and doing it hundreds of times on the cheeks and literally ablating skin. So instead of cutting an ellipse into this area, you just punch out hundreds of 0.4 millimeter punches. And it has downtime. So we went from the ablative resurfacing that we kind of avoided with time because it had downtime to something that has downtime again. Dr. Narwan will discuss this tomorrow. But you can see the results that are fantastic from a single session. Some people need, of course, more sessions. Volume restoration, is something I'm really fond of, and I think it is probably one of the most important things we do. For some patients, it's Botox, that's the most important thing. For others, it's the volume, but it's always one of those two that are the most important. Hyaluronic acid, my favorite, everybody's favorite, works well, precise, resorbable, and reversible. That's the most important thing about it. This is the kind of work I like to do. I think Photoshop. We don't follow trends. We don't just augment. We don't just fill faces. We go after hollows, after folds, wherever it's safe. We restore the shape of the face so people look as if they gained weight, not went to a dermatologist. The reason I'm not into fat that much, especially fat in the lipofilling mode, not the nano-fat that is now done by many colleagues. It's because fat is unpredictable. You have to inject large amounts to see how much you're going to retain from it. So you might sometimes over-retain. And if people, and then it's hard to dissolve it. We use intralesional Kenalog sometimes. But if people gain weight, then it's gonna hypertrophy with time, and it becomes really an issue, as in this, lovely lady who regretted having this. PLLA, done, in so many places now. It's like you go to so many clinics, you hear that, they do Sculptra. I think it should be used very judiciously. It should be customized, like everything we need to do, because it can make people look different. This is a patient who I know from 2011. The last time I had seen her in 2022, that was before her treatment that I did then. She had lost weight, and then she disappeared 3 years, and then I saw her this week, and she looks good. She does look good on the picture on the right, but she looks like a different person. And this is what I think it's important to note with these products that take time to give their efficacy. PLLA continues to improve the skin and build collagen for sometimes up to a year or more. So there is an element of unpredictability with it, and that's why, again, my preference is for hyaluronic acid. On the face, the only area that I find PLLA important is the lower face and people who are really, really thin. Or like have hollowness. Other than that, I prefer to use it on body areas and not the face. Of course, when I say fillers and volume restoration, this is exactly the opposite. This lovely lady who is was a superstar has launched a trend of overfilling the faces, which has been, I think, catastrophic for our specialty, because it is now first people have been kind of disfigured, masculinized. This trend of beautification has been just too much, and now we have an overreaction, of people that are saying, oh, no more fillers because I don't want my face to blow up. These faces blew up because their doctors gave them all this, because the industry kind of pushed for blown-up faces, because that sells more syringes than the doctors who do just 1 or 2 syringes. So hopefully with all these social media things, that approach is going to slowly fade. But now we're spending a lot of time discussing with our patients that fillers are okay as long as they are done the right way, in the right hands, and because misperceptions are all over the place, and I think Dr. Lana will discuss that. This is one man who came to me, And he didn't want to have Botox. We just did some volume restoration. So I think he had about 3 or maybe 4 or 5 mLs of volume into a bit in his temples, his cheeks, perioral area. You can see there is nice, improvement. Although most of the time I don't do just a single approach. One of the areas I love to treat on the face, and it's today the most common area I treat, is the temples. It has been avoided for so many years. Dr. Rami, I find it extremely safe, at least in my hands, because I go with a needle, and I'm a big needle user. The only time I used cannulas on the face are to inject PLLA in the lower face. But here I go on bone, on that safe level that you mentioned. I draw. I use a 30 gauge needle, so I use a product that I can inject with 30 gauge, and then I draw on the bone and then inject. And then I use ice first to get some analgesia, but also maybe some vasoconstriction, and I do it in that arc of of course not the gunshot, but you can see how it harmonizes. Nothing else was done. This is the same person a week later, and she looks, I think, much better than the picture on the left where her cheeks appeared too big. The tear trough is an area that is very delicate. We're doing less and less of the tear trough filler because we have much better tools today to tighten the skin, like the non-ablative laser that I told you before. But if you want to use a filler here, and in some people, when you see this crease, it's the hardest thing to improve without some filler. And there are some really light fillers that we use here. I think you know all the brands in this area that would work well with a minimal risk when you're careful. I also personally use the needle here. You know, many physicians recommend the cannula. I find the cannula lacks a lot of precision, so I like my needle. I use the ice, make sure there is good icing of this area, draw the plunger, wait 2 to 3 seconds, and then inject. And I'm always stressed doing that. So, and I can tell you that in the last few years, I've had at least 3 times when I had blood retract. So people will tell you that with a 30 gauge, it's of course, it doesn't have, sometimes you might be in a vessel, it might not happen, but if you do this, and if you're in a vessel, it happens, thank God it happens. So it's a delicate area. I would suggest that only experts tackle this area. There are really other things that can be helpful in this area. The lips, very important. Just remember, to choose the right product, the right technique. I go, lateral. My colleagues, some of them do the vertical technique. Just remember that the lip is not just floating on the face. There should be, you have to tackle the support of the lip. You have to restore the philtrum, the columella. These are very important things for a natural lip. And you have to pay attention to the chin, because if you do the lip and the chin is small, people look funny. The ear is a cute area to treat. Most old ladies don't know that it can be treated. And now, more and more I mention it to them because it's a hassle for them to put their earrings, to put their, and then they feel that something is too flappy. So injecting a lightweight filler in this area is, really makes them happy. The jawline area, I've started doing jawline maybe like 15 years ago, and then it became, Texas, and you name it. It is, it's important to restore the strength of the bone. There should be a good mandible to hold the skin, but not the mandible should still be smaller than the width of the cheekbones. Most people that we see today, around that have had bad jobs, you see jawlines that are wider, and that looks masculine. So restoring this area is important to improve the face and lift the neck at the same time. Restoring the chin sometimes also makes the nose look smaller. It's a very nice indirect way to give balance to the face, not too much, always undercorrect a little bit. This is going alone again, guys. So, and this patient here, as you can see, she had a scar under her earlobe. She had a facelift. and she wasn't happy. So all she needed was actually a chin filler to give her that definition of the neck. A mini liposuction can be done, simply with our colleagues, and it will help define the face. Improving the symmetry is very important. We use, this really balances the face. I also showed this picture to show you what we can do with Kenacort injections to the thick dermis of the nose. 10 to 15 milligram intradermally into the nose can go a really long way in softening this, and patients love it, and they always ask about it. Threads, try them all. The last batch of threads, I find them useful, and those people where we've done the restructuring, we've done the denervation, we've done the tightening, and they still want more lifting, but they are at the point where I feel that more volume would make them blown up. This is where I would do the threads. And this patient was very happy with her 3 threads applied to every cheek, and that lasted a good year in her case. So nice compliment. Dr. Rami mentioned complications. We didn't have a complication session here, but this is a case I saw 2 days ago. This patient has acne scars, I suggested that we do fractional resurfacing for her. She said, no, I don't want downtime. Why don't we do the filler that you've done for me before? So I took, one of those extremely light HA brands and I injected it intradermally. And I saw this white area on the mid-cheek area. I recognized it right away. I injected hyaluronidase there. So this was an intradermal injection that caused vascular compromise. I injected it with hyaluronidase and looked at the patient, monitored her. The color had gone to normal. The next day, she called me and she said, I have this redness there. So is it reperfusion? Is it more residual tiny fragments of HA? I brought her back and flushed that whole area with about 1 ml of HA, started her on Cialis, on aspirin, and started the hyperbaric oxygen right away. And she is stable. She's going to take some time for that reperfusion to get better and for her skin to gain its color again. But we aborted a vascular event in this case. And I assure you, I take so much care, as we all do, to be extra safe, but things happen. We just make sure they don't hit the fan. Now, back to the muscles. The glabella, always a home run. The crow's feet, a home run, but always a low dose in the crow's feet, so that to avoid the pull of the cheeks when people smile. And the neck, this is from 1998 when I started doing necks and masseter. Very important part of my approach with denervation, because you neutralize that effect of widening the neck and bring it forward. And that gives a nice lifting, a nice contouring of the lower face, and helps augment the effect of the facial Botox. Posture is very important. So many people come to me, I want, improvement here, and then I look at them and they have a forward neck. Everybody's on their phone, on their desktop, or whatever, Pilates, whatever it takes to give them that posture again is always helpful, and it's very important to bring it up to your patients. Of course, what is a beautiful face if there is not enough hair covering it? So we will discuss that later in more detail, but restoring the hair is very important. Eyebrows, and sometimes after facelifts, losing the scalp hair at the hairline can be restored with hair transplants. So here I'm going to just put all of these together and show you some nice customized treatments that we've done lately at the clinic, with the nice pictures to document all that, because we're usually so busy we don't have time to take pictures. Here's an effect with a peel, with Botox to the face and neck, with fillers in the temples, a bit in the cheek and perioral area. and the 532 for the lentiginous. Another one here, also the combination of a peel of botulinum toxin to the face and neck. You can see the nice lifting, a bit of HA, and HIFU. Another case, light peel. You know, these are simple. We do them in like 5 minutes without downtime. They go a long way. Botulinum toxin, some filler, and the non-ablative laser to the lower eyelid. This one, a fantastic result, also nice lifting with a combination of fillers, a bit of filler to the nose, including, and this is a very advanced thing. You know, it's important. In anybody who has had a nose job, I think it better avoid any filler in that area. And that's something extremely advanced that should be done with caution. My approach is, if they've had a surgery, I usually don't touch it. And when I touch the nose, I touch only the midline where there are no, you know, where you know, it's the safest area, if you want, anatomically in terms of vascular supply to inject this area. But this is still a very, you know, critical area. It is something you know, that should be done only by, you know, experts, and there's always a risk of thrombosis or the filler going into the orbital area. Another example of a lady in her mid-40s, also combination of fillers, Botox, HIFU, nice results. An older lady who I would still have wanted her to have an upper blepharoplasty, but otherwise looks nicely rejuvenated. A very old lady, one of my first patients in Beirut in 2004, a combination of resurfacing, fillers, Botox. It was before we used to, you know, I started doing temple filler. That's the only thing she would still have needed, and maybe some additional session resurfacing for her eyelids. So a customized approach that is targeted, that combines all these tools that we have, can go a really long way.